The crises disproportionately affect women and girls, particularly those living at the intersection of multiple forms of discrimination, including and especially Indigenous women and women living with disabilities. Environmental stress, whether driven by biodiversity collapse, land degradation, climate change, or resource scarcity, intensifies existing inequalities. When food systems fail and water sources dry up, when migration and displacement are the only choices, that woman, who often has the least access to political and economic resources, she becomes increasingly vulnerable. Current evidence indicates that biodiversity loss correlates with a rise in child marriage and increased risk factors for gender-based violence. We also see women environmental defenders facing disproportionate online and offline abuse for protecting land and ecosystems and defending the very livelihoods of whole communities. Gender-based violence is not merely a byproduct of environmental crises. It is a driver of social instability that undermines conservation efforts. And yet, gender-based violence interventions are rarely or insufficiently integrated into biodiversity policy, financing, or programming. If biodiversity action does not address the structural drivers of GBV, it cannot be considered gender responsive, and gender inequalities and social instability will only continue to deepen. Bodily autonomy and access to sexual and reproductive health and rights, both fundamental cornerstones of resilience. When biodiversity loss undermines food security and increases climate-sensitive and vector-borne diseases, pregnant women face higher risks of malnutrition, anemia, malaria, and obstetric complications. When health systems are strained by environmental shocks, maternal mortality rises. When displacement occurs, access to contraception and emergency obstetric care is disrupted. Women and girls cannot lead biodiversity action if they are unsafe in their homes, excluded from land rights, or denied reproductive rights. So how do we move from commitments to action? First, we must ensure, as our friend from the UK, Ambassador Tara, was saying, we must ensure policy coherence. The agreed conclusions of CSW must directly inform national biodiversity strategies and action plans. GBV prevention, SRHR services, and maternal health must be reflected in biodiversity implementation programs and finance frameworks. Ministries of environment cannot and should not work in isolation from ministries of health, gender, as they share common agendas. Second, we must institutionalize the agency and full, equal, and meaningful participation of women and young people in all their diversity, not only as beneficiaries, but also as decision makers and leaders. This requires women's participation in legal reform on land tenure and environmental decision making, targeted financing for women-led conservation initiatives, protection mechanisms for women environmental defenders, and investment in girls' education and digital access.